Assumptions by medical staff. The 13-year-old girl arrives at the ER with severe abdominal pain, prompting immediate concern from the medical team. Her symptoms include sharp lower abdominal pain, nausea, vomiting, and possible bloating, which are common signs of several urgent medical conditions. Doctors initially suspect appendicitis, a common emergency in young patients requiring immediate surgery if the appendix is inflamed or ruptured. Ovarian cyst rupture, a condition that can cause sudden, severe pain in young girls and women. Gastrointestinal issues, such as severe constipation, food poisoning, or an infection like gastroenteritis. Urinary tract infection, UTI, or kidney stones. Both can cause severe pain and discomfort. The girl appears distressed, but she does not initially disclose any unusual details about her condition. The medical team begins routine diagnostic tests to determine the exact cause of her pain. Would you like to continue expanding on this or move to the next section? Routine tests reveal the truth. As part of standard emergency room protocol, the medical team orders a series of tests to rule out common conditions. A urine test is conducted to check for infection, dehydration, or pregnancy as a routine precaution. Blood tests are performed to assess infection markers, hormone levels, and overall health. An ultrasound is ordered to examine the abdomen for signs of appendicitis, ovarian cysts, or other abnormalities. The unexpected discovery. The pregnancy test comes back positive, shocking the doctors and nurses. An ultrasound confirms that she is pregnant, revealing a developing fetus. The medical team is stunned, as the girl had not mentioned any possibility of pregnancy. Her parents, present in the ER, are equally shocked and insist they had no idea. This discovery changes the course of the girl's medical treatment and raises serious ethical and legal concerns. Would you like to expand on the reactions of the medical staff and family, or move to the next section? Family's reaction. The moment doctors inform the girl's parents that she is pregnant, shock and disbelief fill the room. Her parents adamantly deny any prior knowledge, insisting they had not noticed any signs of pregnancy. The mother is visibly shaken, repeatedly asking the doctors if there could be a mistake. The father becomes defensive, questioning how this could have happened without their awareness. The girl remains silent and visibly distressed, avoiding eye contact with both the doctors and her parents. The medical staff reassures the parents that the tests are accurate and that they must now focus on the girl's medical and emotional needs. As the parents continue to process the shocking news, the doctors prepare to ask the girl critical questions about her pregnancy, which could uncover even more unexpected truths. Would you like to expand on the emotional tension in the room, the parents' interrogation of the girl, or move to the next section? Medical examination. After the shocking discovery, doctors proceed with a thorough medical evaluation to assess the girl's condition and ensure both her safety and the health of the fetus. An ultrasound scan is conducted to determine the gestational age, confirming that she is in the later stages of pregnancy, potentially second or third trimester. Doctors check for complications, such as high blood pressure or preeclampsia, which can be life-threatening, signs of fetal distress or abnormalities, the possibility of a high-risk delivery due to her young age. Blood tests and physical exams reveal that the girl is severely malnourished and anemic, likely due to undiagnosed pregnancy and lack of prenatal care. The doctors carefully assess her emotional state, noting her nervousness, fear, and unwillingness to speak openly. Given the girl's age and circumstances, the hospital is required to report the case to Child Protective Services and law enforcement. A social worker is brought in to speak privately with the girl, setting the stage for a shocking confession in the next section. Would you like Girl's confession? After the medical examination, a social worker and a female doctor sit with the girl in a private room to gently ask about her pregnancy. She appears nervous, avoiding eye contact, and initially refuses to speak. After repeated reassurances that she is safe, she finally breaks down in tears and reveals a shocking truth. She confesses that she had been hiding her pregnancy out of fear, unsure of what to do or who to tell. When asked about the father, her response stuns the medical staff. She mentioned someone completely unexpected, possibly an older family member, a trusted adult, or someone in a position of authority. The social worker and doctors immediately recognized the severity of the situation, realizing that this is likely a case of abuse or coercion. The hospital follows mandatory procedures by alerting Child Protective Services, CPS, and law enforcement. The girl's safety becomes the top priority, and she is placed under protection while authorities begin their investigation. Would involvement of authorities. After the girl's shocking confession, the hospital staff immediately contacts Child Protective Services, CPS, and law enforcement, as required by law in cases of suspected abuse. A police detective and a social worker arrive at the hospital to interview the girl in a safe and supportive environment. Given her young age and emotional distress, a trained child psychologist is also brought in to help her communicate her experience without further trauma. Authorities begin gathering critical evidence, including the girl's medical records and pregnancy test results, the ultrasound report confirming the gestational age, her full statement about the circumstances leading to her pregnancy. Law enforcement starts identifying and locating the alleged perpetrator, whether it be a family member, teacher, neighbor, or another adult. Meanwhile, CPS evaluates the girl's home environment, determining whether she should remain with her parents or be placed in protective custody. The hospital ensures she receives continuous medical and psychological care, understanding that this is both a physical and emotional crisis. This development turns the case into a criminal investigation, setting the stage for legal actions against the person responsible. Would you like more details on the investigation process, or should we move to the legal and ethical concerns in the next section? Investigation begins. Law enforcement and Child Protective Services launch a full investigation into the girl's pregnancy and the identity of the alleged perpetrator. The police collect evidence and statements. 7. Investigation begins. Law enforcement and Child Protective Services launch a full investigation into the girl's pregnancy and the identity of the alleged perpetrator. The police collect evidence and statements and ethical concerns. The case raises serious legal and ethical issues as authorities work to ensure justice for the girl while also protecting her privacy and well-being. Criminal charges. If the alleged perpetrator is an adult, they could face charges such as statutory rape, child abuse, and endangering the welfare of a minor. If the suspect is a minor, legal experts must determine if they should be tried as a juvenile or adult. DNA testing and evidence collection. A court orders DNA testing to confirm the identity of the father, which will be crucial in the legal case. Medical records and the girl's statement serve as key evidence for prosecution. Parental responsibility. Authorities investigate whether the parents were negligent or failed to notice signs of abuse. If neglect is suspected, CPS may remove the girl from her home for her safety. Psychological and ethical dilemmas. The girl's young age raises ethical debates about how to handle her pregnancy, including decisions about medical care, custody, and future support. Experts discuss whether she should have a say in legal proceedings or if decisions should be made on her behalf. Media and public reaction. If the case becomes public, it sparks wider discussions about child protection laws, sex education, and the role of the justice system in preventing such tragedies. Authorities work carefully to balance legal action with the girl's emotional and physical recovery, ensuring that she is not further traumatized by the process.